We're just figuring out what we're going to do. We've got a couple of ideas. A hardcore series.
Yeah.
Or toys.
They're both the same thing.
Yeah.
So we've got, we want to go deep here.
Yeah.
So what we decided, sometimes you got to take the sledgehammer approach.
I wanna be the sledgehammer.
So
I'm
we
looking
thought
forward to this.
we'd get out a sledgehammer. So let's see what we get up to, eh? Ah. So
You've got to be kidding me. This is going to be cold. Oh no, good. Well,
we'll just start.
That's actually good.
So we've got our sledgehammer here. Just gonna get into the glutes a bit.
That's
So
actually good.
if you remember from our other videos, the sacrum's going down there and the pelvis. So we want to get into where the muscles start. So we've got our tool here, like that. Just showing that you can innovate and you can. Therapy isn't always the textbook way, you know. It's sort of what feels right. How's that, man?
That's so good. It's actually really good. Like, it just feels like an elbow.
Come up with a new tool.
Is it pretty easy for you?
Yeah, it's easy. This is easy. Maybe this is how the world would do it.
Yeah.
Homer Simpson started his chiropractic thing with the
I
trash can.
Trash can, that's right.
Not trash can, son. Dr. Homer's miracle spino cylinder.
Yeah, like that.
Oh, that's so good. Oh.
So we're just working around here. I'll get the model out. So what you can see I was doing there, you've got glutes attaching on here, and they've got the leg bone, the femur hooks up into this hole here. So there's muscles going down to here all over the place. So we were trying to get around this lip here, pushing into these tendons, and then I want to do a stroke that's around here. Okay, so that's where the bone of the leg goes down here, and so I want to hit these glute attachments right in deep around here. We'll do that next bit. So I might be able to use a bit of a corner of the.
Oh, yeah, that's good.
See that?
Oh, yeah.
Get right around it.
Bloody good.
Then up into here.
Oh, yes.
Like that. So, what we might do as well is, seen this one before as well, so most people will have the old broomstick at home, so we want to use the rounded end here like that. Okay, so that replicates, looks a bit like the shape of a thumb. So what we can do is we want to find the landmarks again. So what you do when you get better and better at being able to treat people, you want to be able to know where the skeleton is. So we want to go in right in close, because where the skeleton is, that's where muscles join onto. So if you want to be able to be effective, we need to go into those bits on where the tendons start and join onto the bone, and then use your intuition. So we want to really, tune into that. So you work with the person. So tell me, Aaron, can you feel where stuff is starting to?
Yeah, I feel like I want you to start there and then scoop it back up towards the roof almost. Like,
So in there like that,
that's it.
and then we can scoop like that. So you see how the angle changes? Like that.
Oh, that's good. Oh.
So you can probably go another angle that way.
Oh, yeah. Oh.
So I'm pushing in like
Oh,
that.
that's it.
You can just follow the angle, so it's spearing down in, and then if I keep that same engagement, same level of pressure, and then I change it like that. See that?
Oh.
And that was a scoop. Okay? Like that.
Oh. Oh.
But we wanted to make this a hardcore video, so we want to do a hardcore lower back. So we want to show you how I actually get into the lower back really deep. So what it means to get in really deep, we want to get into our money spot. So we want to get into there. So we want to spear right into that pocket there like that. So you go in nice and slowly at the start and just let that tissue all start to warm up on the surface, and then the different layers will start to warm up and start to mold and melt. And then what you can do, you start using your body weight. So I'm sort of lifting this leg here off the ground, so more my body weight will come through, and then I can start to use this hand here to grab onto the table. So I'm doing a counter lift, I'm pulling that up and then pushing down that way. So we go like that. So drop my leg, drop my body, and then pull on the table like that. Okay. So sometimes you need to get in really deep, like this.
Fuck! Oh, jeez.
So you're just holding it, then we're trying to spear. So I just change some angles, so I go that way a bit more to spear more in, like that, to get right to the depth where that stuff started. Like that there. So I'm really pulling hard with this hand and pushing down like that. All my body weight is dropping like that.
Fuck. Oh.
So we can show you with a stick as well.
Oh.
I'll just show you real quickly. So you might have seen this a little bit before, but you can just see how deep these crevices are. So you got right in here, and so on the sacrum, it's actually deep in here. So my finger is deep, so the layer of fascia would be deeper than what my finger is. So you can actually push on that, and then you can melt and affect where these nerves are coming out of these little holes. What we're doing with the money spot, we want to get in here like that into this area where it can become stagnant and stuck and blocked, rigid. And we want to get right into there and just melt it right where that stuckness would have started. Okay. So with a stick, we do a similar kind of thing. So we'd be in on an angle like that. So you start off slow. And then you build it up. Grab the stick. And then go in on that angle. Like that. Okay. On that angle. And then if we want to do the fascial continuum, we're going to go over like that. So we go onto the bone then, and then we're on top of it. So we needed to just not go too hard once we're getting onto that sacrum. And then we can go onto these bits here. So you can actually push some pressure onto the sacrum and weave along. So you've got that like a little mountain range in the middle of the sacrum. We can weave in like that. Do some little movements.
Yeah, that's a good one.
So yeah, you just see you can systematically work and just find out exactly where the spots are. Because like if you're working with somebody at home, wherever those spots are, you can just identify them and you just tune into the feelings as well. So you know what good pain is, you know what trauma is. So tune into that. If it's traumatic, you got to back off straight away. But if you're really up for it, then this can be just a thing.
Oh, that's good.
Anyway, so there's a bit of hardcore treatment you can do at home. So find some sticks, sledgehammer, a rolling pin, whatever you got at home that has got rounded surfaces, or like the sledgehammer, like it was a really good tool that we could get in and
That was great.
and have a go. But just think about the skeleton, I suppose, because the skeleton is so important because that's what the muscles attach onto, and they've got to attach onto little nooks and crannies and crevices so they can actually have a chance to stay stuck onto the skeleton. So if you can trace the skeleton, trace around the bones along here, you're going to have a lot better chance of affecting a change. So that's what it's all about. We want to affect change. Stuff that's stuck, blocked, rigid, stiff, all these kind of words, they're the things that we want to change. So they need to be melted in a way, and then flow can occur, then healing can occur. So yeah,
That was great. Yeah.
Give it
Great
a go.
tips there, guys. Have a crack. I guess what Nina's trying to say too is, I mean, this is obviously what you do if you've got a partner that you're trying to do these techniques on, but even if you're doing some work on yourself with a ball or whatever it may be, even with a roller, try and get close to bone, because that's where it's going to be the most effective for you.
yeah.
Sweet. Thanks, guys.
Have a go.
Done.
Done. It's probably a good little video.
Yeah, that was fucking
Out of
sick.
nothing.
That was great.
1, 2, better not sue.
Yeah, the sledgehammer felt really good.
Yeah.
Probably makes you realise too, maybe there are ways that making the job a bit easier on yourself.
Yeah. Because that was pretty easy.
You just sit,
I
yeah,
was
you
just
just,
sitting there. There's knowing where to push, isn't it?
yeah, 100%. Done, man.
Happy with that? Do you want to do one?
Oh, bloody
Have you
hell.
got anything? Anything in your head?
I probably didn't.
We probably did ours the other day.
Hmm.
Or is it a conceptual one? Yeah. I think if we catch up to Friday.
I think let's catch up to do the conceptual ones again. I might have a treatment one in me on Friday too.
And if you want a treatment as well, like on your calves or your knee or something. Do you need any
Could have a
treatment?
sprint together, eh?
Mm.
That would be great.
I think we could. Oh. Did stop.
Oh really? You're going to give an insight into what we're like off camera.
Bye.
See ya.